Minet is a trusted Pan-African advisor that meets the unpredictability of tomorrow by delivering risk and human capital solutions today. As the largest Aeon Global Network correspondent, Minet has access to a network of over 50,000 peers in 120 countries, as well as proprietary data, research and analytics, which enables it to manage and secure the risks of tomorrow and provide clients with an unrivaled advantage. Speaking at a workshop organized by Minet Kenya for human resource practitioners at a Nairobi hotel, the CEO of Minet Kenya, Sami Muthui, said several factors, including the increasing incidences of national drug code, have conspired to drive the healthcare costs past the country's inflation rate. Mr. Muthui said that while the medical insurance industry recorded a growth of 0.65% in growth premiums, claims incurred over the same period increased by 12%. He also noted that the company's internal analysis revealed that several hospitals increased their costs twice as high in 2017 compared to 2016.
Indeed, healthcare inflation is a source of major concern, but not just in Kenya, but globally. Last year, we estimate that the healthcare inflation was at about 12%, while the country's general inflation rate was about 6%. So it's about double the general country inflation rate. And the effect of this is obviously very material to, the accessibility of healthcare by Kenyans to proper medical care. Now, the mitigations for this, the reasons for these are many, and maybe I could mention just a few. The cost of inputs of much of what is used in healthcare, from equipment to drugs and that kind of thing, obviously is imported, and therefore there's a lot of imported inflation. Secondly, our consumption patterns as Kenyans also. We are very, very much brand-oriented, and we kind of tend to shy away from using good generics. That also contributes to the high cost of medical care. Another one is our consumption patterns also, in terms of the practice of medicine itself, also contributes to the cost of healthcare. But I think more importantly, one of the key drivers of cost of healthcare increasing in this country has been the increase in non-communicable diseases.
According to the World Health Organization, of the 38 million people who die from non-communicable diseases in the world each year, 75% come from low and middle-income countries. In Kenya, non-communicable diseases account for over 55% deaths annually and more than 50% of hospital admissions, according to the Ministry of Health. Mr. Muthui further added that there is no discussion about the future of medical costs that can take place without focusing on the rapid spread of non-communicable diseases in the country. Employers can play a key role in curbing the spread of these diseases through their medical plans and the implementation of wellness and prevention programs. He also emphasized that employers are already proactively sponsoring various types of preventative healthcare programs.
There's certainly need for great encouragement and possibly some level of legislation to encourage the usage of good, tested and proven and certified generics, because the cost of these are so much less than the branded drugs. However, as a country that respects also intellectual property, there is obviously still space for branded drugs to play a role. And so long as the regulation and the practice of it is well controlled, the two do work side by side. However, we are a developing country. A majority of our people are low-income people. We have a good number of people and a good percentage of our population that cannot access healthcare because of costs. So we have to take a more proactive approach to reduce the cost of healthcare, and especially the cost of medicines, by going the generic way.